Tonight, Riverside County is at a critical point in the pandemic, and health officials here worry the number of infections and hospitalizations will soon get much worse. I spoke today with Dr. Geoffrey Leung from Riverside University Health System for the latest update and also find out more about the county's plans for the vaccine. Dr. Leung, it's good to see you again. Thanks for joining us.
Thank you, Peter.
Let me start by asking you, where does Riverside County stand at this point in the pandemic, especially after reporting thousands of cases and a record number of hospitalizations?
Riverside is at a critical point, probably not unlike many other counties. We are at a record high in terms of daily new cases as well as hospitalizations. Right now we have over 1,000 or actually over 1,200 COVID hospitalizations. And if we continue at this current rate, we could have twice that level in 3 to 4 weeks.
What are you hearing from hospitals, Dr. Leung, especially now that ICU capacity is at zero and has been for several days? Have any hospitals stopped elective surgeries, or will that medical station at the fairgrounds in Indio be in use soon?
Yeah, so the hospitals that we know of have all stopped elective procedures. They've done everything they can to preserve the space for COVID individuals and other individuals who may need emergency services. We're not sure about additional space. We know that the primary rate limiting factor is staffing. And so many hospitals have been very creative about adding space for ICU and hospital beds, but the challenge has been keeping up with adding the needed nurses and doctors.
Our surge in cases comes as vaccines are starting to roll out here in Riverside County. Where is the county at in terms of the rollout, and are hospitals still working on vaccinating their healthcare workers and residents at long-term care facilities?
So vaccines are the silver lining. On Thursday, Riverside County did receive its first shipment of COVID-19 vaccine, and the county has been in the process of redistributing that to hospitals that may not have received shipments directly. Hospitals are now vaccinating and starting to vaccinate their highest risk healthcare workers, and this is a very important step forward for us, but we still have a long way to go.
When is the first phase of the rollout expected to finish?
So this will be different for every hospital, but hospitals that are receiving their first shipments are trying to vaccinate their highest healthcare workers who are at greatest risk within the coming week. So this is all happening very quickly.
The CDC had given recommendations for who should get the vaccine next, and that includes people ages 75 and older. Will Riverside County be following this? And if so, do you have any idea how this will work?
So Riverside County will be looking first to the state for guidance. We have a very prescribed plan right now with different tiering, but we will definitely look to the state, which will take into consideration the new CDC guidelines.
Now that the Mederna vaccine has been approved for emergency use, when will Riverside County receive those vaccines? And do you know how many that the county will receive?
So Riverside County is currently working with the state on the Mederna vaccine. We believe it could arrive as early as this week, but we do not have a date yet. And in terms of the allocation, we don't have a final number as of right now.
Does the Mederna vaccine change any of the county's vaccination plans?
So the Mederna vaccine is important because it does not require the ultra cold storage. That will make it much easier to distribute and set up vaccination sites outside of acute care hospitals. So that will broaden the way in which we can provide vaccination for the community.
All right, part two now of my interview with Dr. Geoffrey Leung from Riverside University Health System Medical Center. All right, Dr. Leung, we invited our viewers to submit some questions to you ahead of our interview, and I would like to ask you a few of them. One viewer wants to know, is it safe for pregnant women to get vaccinated, or should they wait until after giving birth?
So that's a great question. We do not have enough data right now. So the official statement is that we do not have data that says that the vaccine is not safe in pregnant women, and there is not a formal recommendation to necessarily avoid the vaccine in those who are pregnant. All that being said, the safety data has been very encouraging for the Pfizer vaccine, and the rate of and the types of side effects are fairly similar to other types of regular vaccines that we give out routinely.
All right, here's a question from another viewer. My husband and I are part-time residents living here for 5 months in the winter. We are both on Medicare. We would like to know if we will be able to get vaccinated while we are here. My husband is high risk and also has doctors down here, but I do not.
So when we have enough vaccine, absolutely, we will be taking care of all of our residents within the county. The big question is when will we have enough vaccine to reach our additional groups of county residents who may be at high risk, whether they are full-time residents or part-time residents.
Another viewer would like to know, will these vaccinations be mandatory in any way? And related to that, do you know if employers can make it mandatory at workplaces?
So at this point, there's not clear guidance on whether employers can make it mandatory. We've seen similar discussions with things like the flu vaccine. And in most cases, employers with the flu vaccine highly encourage it, but do not mandate it.
All right, here's another question from a viewer. Do you recommend the vaccine for those who have already tested positive for coronavirus?
So we do recommend the vaccine for those who've tested positive. If someone has tested positive, we would like to wait at least 3 months until a period before giving the vaccine. But because there is the possibility that someone could become reinfected, and the immune response that we see from the vaccine is much greater and much more effective than what we see after having a natural infection, we do recommend the vaccine even if someone has already had the infection.
Okay, and finally, one viewer would like to know, is the vaccine like an immunization or like the flu shot? What are some of the side effects? Will insurance pay for the vaccine?
So first of all, we do expect that the vaccine will be covered. And the side effects are similar to what we see with other shots like the flu vaccine. So the most common side effects are things like soreness in the arm, maybe some fatigue or tiredness afterwards, and in maybe 2 or 3% of individuals, some mild fever. But we do expect all of those side effects, which are usually not significant, to wear away within 24 to 48 hours.
All right, Dr. Leung, we appreciate your time. Thanks for joining us.
Thank you, Peter.